Thank you, everyone, for joining us. My name is Frank Finnemore. I'm the Executive Director of the Cleveland and Woodley Park Village, the sponsor of tonight's event. And I'm really happy that we're doing this educational series. This is the first of a three-part series. Tonight, we're going to be talking about what you need to know and how to choose and all the ins and outs of hiring a home aide. And this is near and dear to my heart. Many of you know that my 93-year-old mother with Alzheimer's lives with me and my family. And I couldn't do this without the assistance of the aides that I have for her. And it's been really invaluable. So this is a really important topic, and I know firsthand. The second part of our series will be in a few weeks. We're still working out the details, and that will be with 5 or 6 home care agencies themselves, speaking about their services and what they provide and how they provide it. And it will be an opportunity for each of you to ask them questions and get clarifications and hear from them directly. And then the third part of the series will be members of the community that have hired private individuals as caregivers. And we want to hear from them and find out how that went, how that works, and have you have an opportunity to speak with them. A mentor of mine, a fellow executive director, said to me recently that it's really important to make sure that you do advanced planning because then you have more choices in the midst of a crisis. You already know what to expect, and you therefore take more control of your life and your situation. Because you have that knowledge in advance. So that's a real key reason why we're doing this series. We want all of you to have the information that you need to make the best choice for you. Just a couple of housekeeping items. One is we will make this available tomorrow on our website. That's cwpv.org. And it's going to be in the blog section. So you just go to the main homepage, you'll scroll down, and then you will be able to see the event, and you'll be able to click on that. We will be taking questions, but I'm going to ask you to use the chat, and then I will go through the chat and ask Christine to answer those questions. And we're going to try to wrap up by around 8 o'clock so that then we can open it up to all the general questions that may still exist. So with that, I'd like to welcome Christine Bitzer from Seabury Resources for the Aging. With us tonight, she's a licensed clinical social worker. She's the director of their care management team and very knowledgeable on this subject. She's been with us before, so thank you, Christine, for coming back with us. We have a full house tonight of, we had over 100 people register, and I think about half of them are here tonight, and I'm sure that they'll be coming in. So with that, I'll turn it over to Christine.
Thank you, Frank. Yes, it's nice to be back. Thank you all for having me again on this important topic. Fortunately, I will be sharing my screen because I'm in a different place and there's a very bad light going on here. I should also warn you that I have little kids who are about to start getting ready for bed. I am in the most private area I can be, but I won't guarantee that you might hear some of that happening. Let me share my screen. Oh, I just lost you here for a second. And then I can get on and okay, there it goes. All right. So there we go. Yeah, as Frank said, my name is Christine Bitzer. I am a clinical social worker. I've actually been working as a social worker now for, I would say, over 20 years. And the first place I started was actually in home care. So this is something that has kind of followed me through my entire career, because certainly as a care manager, this is one of the main questions that we ask or get asked, I should say, and then help arrange for. And as Frank said, I don't mind questions. I think, that's probably also going to help move this program forward. So, and I'm comfortable with answering. Frank, I think, knows that. So he'll monitor and give me the sign that you all have a question. I first thought the good place to start would just be on the training and the role of who we're talking about here. I know there's always some confusion about, is this a home health aide? Is this a home care aide? What's the difference? Does it matter? In many regards, it doesn't matter what you say, but when you say home health aide to me as a social worker, I start thinking about skilled care. And to me, skilled care means that Medicare is going to pay for it. And the type of care that we're talking about, Medicare is not going to pay for. Home health aides are usually provided to a client through Medicare or their health insurance following an inpatient stay in either a hospital or a rehab facility. And again, in the hospital, we're not talking about an observation stay. We're talking about an inpatient 3-day overnight stay. And typically, if you are assigned a home health aide following a inpatient stay, it's for a very short amount of time, and it's for things like bathing and dressing, and they really can't do much more for you than that. So I kind of wanted to get that out of the way. I'll say home care aide throughout this entire presentation, because that's how I tend to think of this type of paid caregiver. Typically, these individuals are certified nursing assistants or CNAs. If you happen to be coming to us from another jurisdiction, it may be called a different name. For example, over in Maryland, this is called a general nursing assistant, so a GNA. They're primarily trained to take care of the ADLs, and ADLs are our activities of daily living. So things like bathing, things like dressing, maybe feeding if somebody is a little more advanced in their diagnosis, or have stronger, heavier limitations. They can also help with the instrumental activities of daily living. These are the things that support the activities of daily living. So things like grocery shopping, things like meal preparation, transporting somebody to the doctor's appointment, doing some light housekeeping, not being a housekeeper, but doing some light tidying up after making a meal for someone. And I would say, although they're trained in this, the training on this is a lot less, because really they're, as a CNA, they are kind of moving toward, some of them may be immigrants who came from another country and they just need to restudy again to be, to meet our criteria and become RNs. And others of them, that might be their main goal. So the instrumental activities of daily living tend to be more of a secondary thing to them. And I bring that up because oftentimes that's where some of the concerns and the problems are, might come in. So just checking on that chat. One thing they cannot do is, in none of the jurisdictions in this area, can they administer a medication. So they can remind you to take your medication. They can remind the care receiver to take their medication, and they can pop the top or open the bottle, but they aren't technically supposed to touch it, and they aren't supposed to fill a pill tray or do anything like that. Some CNAs do have an additional license called a med tech, license, and those individuals can do it, but if you're hiring through an agency, you would need to have, they would need to have a nurse oversight to be able to actually do that for you. So that usually comes at a higher cost. And I will be getting into the cost in a couple of slides. An LPN is the next level that would be able to administer the medication and fill the pill trays. But when we're talking about this, we're really talking about hiring a CNA or a GNA. I should add that in the District of Columbia, some of their caregivers through the subsidized program, they might actually even have a little bit of a different licensing, which is called a home care aid license, so an HCA license. And again, that's kind of that very first step on the way to becoming a nurse. So I hope that kind of makes sense and gives us an idea of what we're talking about. As I mentioned,
Christine, we have one quick question. Someone wanted to, just some clarification on the difference between the home health aides and home care aides.
Yeah, so home health aides is skilled care. It's ordered by a doctor. And with that order, Medicare will pay for it, but it is typically very short term. It tends to last about 6 weeks, 6 to 8 weeks. It follows along with the physical therapy and the occupational therapy that you're probably getting, which are also different types of skilled care. And usually it's for about an hour a day, again, to do something like bathing and dressing in the morning. So I hope that kind of helps with that. So what we're really talking about is a home care aide. And when a hospital, I know we have a lot of people who come to us because they feel completely lost. They've been in the hospital, and now the hospital discharge planner is telling them that they can't go home unless they have 24 hours of care. Home care, Medicare is not going to pay for 24 hours of care. So what they're talking about when they say that is a home care aide. Hopefully that kind of helps with that clarification. In this area, the service providers come in kind of 2 different buckets of individuals. And those are exactly the groups that Frank is going to have come talk to you in the next 2 panel sessions. The first one is really through an agency. Typically within the agency, there may be 2 different types of caregivers or home care aides. There may be contractors or there may be employees. And most agencies either do contractors or employees. There is one company in the area that has both that I'm aware of. With the contractors, again, they're working as 1099s, so they're often going to be less expensive. With employees, they'll have oversight by a nurse. Their home care company will usually ask that there be a nursing assessment done before they get started. Frequently, they would be able to start the service kind of in tangent with the evaluation by the nurse, or if, for example, somebody's in the hospital, the nurse will come out to the hospital to do the assessment sometimes. And that's just so that they can develop a plan of care. If you go the contractor rate, then they won't need that. You'll have to sign an agreement with the agency, but there won't be any nurse oversight. The nice thing about an agency is they take care of a lot of the aspects that we worry about as far as hiring somebody. So they take care of the interviewing of individuals. They take care of making sure that their licenses are maintained. They take care of liability. They take care of scheduling. If, for example, one of these caregivers who, ends up getting sick, or they end up having something come up with their family member, it's the agency that will then find a substitute caregiver to come in and work with you. They also take care of the taxes and the workers' comp and Social Security and all of those things that come with employing somebody. Now, I would say the one difference with that is that if you choose to work with an agency that has contractors, they may consider themselves as more of a referral agency. And so what that means is they're kind of just being the conduit, and they'll even set you up maybe with the payroll system that would pay them. It used to be when I started this particular job, I guess that was about 17 years ago now. If you hired a contractor through an agency, they would still kind of handle the scheduling, they would still kind of handle the substitutes, but at the end of the week, you would be the one who's signing the timesheet for the caregiver, and you would have been turning over a check to the caregiver. Now, the way that has changed is that nobody wants to touch money anymore. And so they have a payroll system set up, and hopefully that takes care of some of the issues with the taxes and such that come in. I see there's a couple of questions that actually relate back to the other slide. Yes, home care aides the question is, are home care aides hired privately, and are there more hours? Yes, a home care aide would be hired privately by you. And the number of hours, really, there is a minimum number of hours that are accepted by the agencies. That's going to be in the next slide, but I'll review it here. In this area, the minimum number of hours that you can hire a home care aide for is a 4-hour block of time. During the pandemic, that really increased. So what we saw during the pandemic was that most agencies had to say that you had to hire a 6-hour block or maybe even an 8-hour block. That's kind of coming back down, and you can understand why, because these home care aides go from job to job trying to make a full-time schedule for themselves. So, and if they have a 4-hour shift, they need at least 2 shifts a day in order to make 8 hours and get a full-time job, at least for that day. And during the pandemic, we didn't want somebody who had already been to one other house before us, possibly even 2 other houses before us. And if not today, then the day before they would have been at somebody else's house. So clients and caregivers demanded, and caregivers too didn't want to be going into 3 different houses. So they demanded that they have longer shifts. That has come back down a little bit, but what I have heard recently and seen recently is that 8 hours still tends to be kind of the sweet spot for the caregivers and the agencies that hire the caregivers. And some of the places that have 4-hour minimums, they are asking for 8 hours for the week. So you could have 4 hours on Monday, 4 hours on Wednesday, and then you would meet your 8 hours for the week total. And again, you can't divide it down any further than 4 hours. And yes, Medicare does not pay for a home care aide. They pay for a home health aide only after a hospital stay. That's what makes this confusing, and what people begin to say, hey, Medicare does pay for it, but it's really not even worthwhile to consider that. There may be some other Advantage plans that might have a little bit more hours, but I haven't really heard of any. So with the agency, back up to this slide on the where do you find these people? That is a question to ask the agency that you choose to work with. If you choose to go with an agency, is do they use contractors, and do they consider the contractor their employee or your employee? This also matters if you are going to try and charge long-term care insurance for this, or ask long-term care insurance to pay for this, because long-term care insurance will care about that. And I'll go back to that in a moment. The private duty aides is really what we call the gray market. So private duty aides typically have the same skill set. They're typically CNAs. There's lots of different ways you can find them, but usually it's through word of mouth. You see somebody else in your neighborhood, you see somebody else in your building. Actually, it was kind of entertaining. I live on a townhouse community, and last night, as the kids were out playing, this black SUV pulled up, and this gentleman was sitting in the car, and he made a phone call, and suddenly this woman ran out of the house and hopped in the car. And all of my neighbors were like, "What's going on in that house? Who is that? Is that another renter?" And I was like, "No, it's a caregiver, and she's being picked up by her spouse." And they were like, "No, that's not true. I haven't seen anybody who needs help in that house." Well, this afternoon, I happened to be home. Same woman who ran out to the car was busy assisting somebody who had clearly just had surgery or broken their leg. And so they needed a caregiver following them. So that may also be the way that you find your caregiver, is you see them walking around and you politely kind of scoot over when they're free and ask them if they're available. It may also be, what I've seen a lot of are nannies who kind of transition over into home care aides. And again, they would not have the same training. So usually in that case, it's, okay, the children don't need help anymore, but now mom has moved in. Or the children don't need help anymore, but now, and by mom, I mean grandma. So this becomes a multi-generational house, but I've also seen it where somebody gets early onset dementia or something. So it just moves right on over into a home care aide. I would say that is one of the challenges and drawbacks to a private duty caregiver, is you really have to be the one that's doing the homework on that. You have to be the one who is doing the interview and getting to learn about what the licensing is and how do they get their training, and try to make sure that that individual has the training we need. Because usually the skill set of somebody like a nanny or a former housekeeper is very different than the skill set for doing home care aid. As I mentioned back in the beginning with that original slide, the certified nursing assistants are really trained to know best, how do you transfer somebody out of bed, or how do you assist somebody out of bed and into the shower? How do you take care of somebody if they're bedbound and they need to be turned or they need to be bathed? How do you take a temperature or blood pressure? All of those types of things we don't typically have training on. Let's see here. So with regard to the rates, this is always the part that everybody really wants to know about. The rates, again, have really skyrocketed since the pandemic. When you hire a contractor through an agency, it's going to be around $32 an hour. Again, if you're hiring a contractor, either you or the contractor is having to take care of the taxes, et cetera. So that's, and then there's not that oversight. So you're not paying for any of that. If you have an employee of an agency, then it's probably going to be around $35 an hour now. And again, you'll have what Frank said, you said about 5 different agencies. And then later on, you'll have private duty. So you'll be able to kind of compare those costs. The one thing that we haven't talked about yet is a live-in provider. This is something that most agencies will offer. They have very few live-in providers, though. A live-in is a little bit different than 24-hour care, although they are on the premises for 24 hours, but they're living in. So when the doctor says, or the social worker discharge planner in the hospital says, you know, so-and-so can't go home unless they have 24-hour care, they are talking about somebody who's going to be awake for the entire 24 hours and be able to assist if there are any needs. That's not going to be the same person. Particularly here in the district, the district government is very concerned about home care aides working more than 40 hours a week. Now, most home care aides work more than 40 hours a week because they cobble things together. And because if they're not getting enough hours from agency 1, then they're now going to go work for agency 1 and 2. And they're going to make it meet for their needs. And if they are an immigrant who's also supporting a family back home, this is where it becomes very important for them to be able to work as many hours as they want. So it's always good to know where your caregiver has been the day before. Were they actually trying to do an overnight shift someplace else? But technically a 24-hour shift should be covered by people. It's probably going to be covered probably by 2, if not 3 people. And then you'll have you'll probably end up with, I think, 6 caregivers. Just because if you need something Sunday through Saturday, you've got to be able to split all of those times up. So they're not working a lot of overtime. The other thing in the district is that if a caregiver works for an agency, they'll have to pay them overtime. And so the agencies also have the impetus not to schedule them for overtime hours. A live-in, on the other hand, you can only use a live-in if you do not need somebody to be awake at night. So this is typically somebody who really doesn't need a lot of help at night, but they might have really early hours in the morning or really late hours in the evening. And so it makes sense to just hire somebody to be there. Maybe they want to have a little bit more flexibility with the individual, have them be able to come to doctor's appointments and not have to worry about, you know, I have to get home right away because it's the end of their shift. And I really wanted to go grocery shopping. So it gives you a little bit of flexibility. Usually it's 2 or 3 providers that would be assigned to an individual who wants a live-in. They do have to have their own room to sleep in, and they do have to be allowed 8 hours of kind of sleep and downtime, with also some breaks during the day. There's also the cost of the food, because it then becomes your job to also pay for their food as well. So I hope that makes sense, the difference between 24-hour care and the difference between a live-in provider. What I've usually seen happen is that somebody may start with a live-in provider because they like that idea better. They like having that relationship. It might give a sense of comfort, and usually it's a little less expensive, although one agency that I spoke with in preparation for this talk said they will charge you for as many hours as they're supposed to be awake. I said, okay, so that's not really giving them a deal in getting live-in care. That's just charging your full amount for the time that they're working. But typically the live-in rate has been set up so that it gives a little bit of a deal. Where I've seen this work out is when somebody does not need to get up during the night, And where I see it start to fail and the agency comes back and says, no, we need to put in 24-hour care, we can't have a live-in, is when that individual starts getting up a lot at night. And not everybody does, but if they do begin getting up 2 times a night, 3 times a night on a regular basis, then the agency will ask you to go ahead and switch it over to 24-hour care. Oh, somebody's very nice. They didn't ask. I did not explain what Seabury was. I'll go into that at the end. So remind me about that at the end. I did already talk about the minimum per day. Again, usually it's most agencies do about a 4-hour minimum per day. And then sometimes they do have the added piece in now that you have to have 8 hours per week. The one exception I have seen to this is for some buildings, for example, the residences at Thomas Circle. That is a senior community which has a majority of independent living, and then they have a very small assisted living, and then a medium-sized memory care over there. In their, oh, I just blanked on which company is there, but there's a company, it just switched recently within the past year. They do have an agency who has an office in that building, and they're able to do flex care. So that agency, it's going to bother me that I don't, that just went out of my mind. That building, the agencies that is there, they have a nurse who's on staff as well, or not on staff, but has an office there and is there 5 days a week. And then there's a caregiver who comes in 5 days a week as well. And in that case, because the caregiver is based there, they're able to offer what's called cluster care or flex care. And that's for the question that we always get, which is, but I don't need 4 hours. I just need 2 hours to help my husband or my wife bathe, get up and bathe and make it through the breakfast routine. So in buildings like that have a company that has put up a staff in there, they can flex that time. They can go to different apartments, and it's because of the proximity. So they have efficiency in hours at that point. There's another question in here. Yes, so do full-time employees grocery shop and take individuals to the doctor's offices? Yeah, a home care aide, although they are trained to do activities of daily living, they can also do the instrumental activities of daily living, which includes grocery shopping. So usually when my clients say, well, I don't need somebody for 4 hours, what am I going to do for 4 hours when they're just sitting here staring at me? Well, it takes about 3 hours to do laundry. You don't necessarily need them to sit with the laundry, but if you feel like they need to sit with the laundry because you live in a condo building and things have disappeared from your laundry room, then that's time that somebody needs to be down there. And it does take, right, about an hour and a half to 2 hours at least for one load of laundry. And most of us with sheets and things and towels have at least 2 loads of laundry, if not more. They can also do grocery shopping for you. Again, they can accompany the client to the grocery store, or they can go on their own. One of the things you have to work out is, well, how are they going to pay for that? And that's really up to you and up to the agency. I've seen some individuals who want to go with the caregiver, and this is always a good outing to go on, is to go with the caregiver. It also helps get a better idea of what types of food the care receiver likes to eat. Because again, typically these individuals are immigrants from Africa, or they are immigrants from Central America. And so they may not eat the same food. One one of the biggest complaints I hear is they can't even make oatmeal. And that's probably because they don't eat oatmeal in their country. And that's not, again, that's not something they're trained on unless the agency has a special training program, which some agencies do have special training programs like that. So that's one of the other things that I talk about as a care manager with my clients is, okay, well, what are the needs in the household? What can a caregiver, what are you willing to have the caregiver help you with? And even if, say, a client really needs bathing assistance, but they're reluctant to have bathing assistance, well, maybe there's something else that the caregiver can do that's a little less invasive of space, personal space first to get to know the clients. And maybe that is grocery shopping. Maybe that is helping with the light housekeeping. Caregivers do not do housekeeping as your housekeeper would. And they definitely don't do deep housekeeping. So if a client of ours already has a housekeeper, I take a look at, okay, is that something, is what your housekeeper does something that the caregiver can do? And what's the difference? And then is your housekeeper coming twice a month? Because now maybe you only need them once a month. Is the housekeeper willing and able to do things like clean out the refrigerator? Because a caregiver will not be allowed to do that. So these are the conversations we kind of talk about as we're really honing in on what is this caregiver going to do. The other piece of the question was about the medical appointments. And yes, a caregiver can assist a client to a medical appointment. It is their role, for example, to help the individual up on the table, to help the person dress or undress if need be. Now, if you need a note taker when you're in the medical appointment, let's say you're a caregiver and your care receiver is fine going by themselves with the aide, but you also want somebody who can take some notes. That may or may not be the aide. Again, some of these aides, that wouldn't be an appropriate job for them, especially if they need to be keeping an eye on the client. So I think it really depends upon what and I keep using client and care receiver interchangeably, and I'm sorry about that, but it really depends upon what the care receivers can do while they're in the doctor's appointment. Okay. Yes, we're going to talk about kind of where to find home health aides. Probably the next slide, actually. Oh, the first one's paying for it, and then we'll talk about where to find them. So again, we already covered that health insurance doesn't typically pay for it. Long-term care insurance will pay for a home care aide. This is one of the reasons why we have long-term care insurance. Typically, they're going to want a licensed provider that's through an agency. The other thing that I've learned through the years is there's very specific documentation that they're going to want, particularly during that 90-day exclusionary period. And if you have a contractor or you have a private duty aide, you are going to need to do that documentation yourself. So making sure that what the caregiver is doing for you is matching what the long-term care insurance company would like them to be doing. Usually long-term care insurance comes into effect again after 90 days because they want to make sure that this isn't just a brief interlude, that this is something that's going to be more long-term. And it needs to be a specific, I think it's at least 3 of the ADLs, which is pretty quick to get into. The other thing I've seen with the long-term care insurance is it really, especially with that 90-day exclusionary period, it's really good to double check with the agents or the insurance. How do they count that period of time? and take advantage of what they offer. I had somebody who had an extremely good plan. Usually that 90 days needs to be a block of 90 days. And they might let a week or something go by, but they're not going to let a longer time span go by. And this person's long-term care insurance was actually fine with it as long as it happened in the first year. And myself and the agency were begging them to just go ahead and start the process, but they were really overwhelmed by the paperwork and they never went forward with it. So they had this great long-term care insurance policy that they never accessed. So what do localities pay for? So some localities do have, in fact, most localities through their Agency on Aging do have a program. Remember, when you're talking about an area agency on aging, that is part of the Older Americans Act, which is a federal program. Most area agencies on aging have been kind of rolled into the Department of Aging, but you will find that there, and specifically respite care for caregivers is one primary thing that you can find with your Agency on Aging. In DC, that is called the Caregivers Institute, which I just put in the chat. The Caregivers Institute has a lot of different supports for caregivers, and in this sense, I'm talking about a family caregiver. Caregivers Institute has a lot of support for family caregivers, including some respite time. And respite might mean some hours with a caregiver to give you a break, the family caregiver a break to get out of the house, go to their own doctor's appointments, just to go out for coffee with friends, anything like that to get a little bit of a break. I know if anybody is on from Maryland, there is a respite care program that is through the ARC, and I've actually seen them pay for like a week at a memory care facility. So that's a really nice benefit. And that's pretty much all you'll find. Most localities do have a little pocket of money for home care. There's usually a very long wait. In DC, that same link that I sent you is from the Home Care Partners website, because Home Care Partners also runs the Caregiver Institute. They do provide the subsidized home care in the District of Columbia. This is where I actually started my career. It's a great resource and program in the district, but there will be a wait for services. And typically with Home Care Partners, with Home Care Partners, you don't get to choose, or any program through the locality, you don't get to choose how many hours you have. Their nurse comes out and assesses the care receiver or the client and then distributes the hours. Typically for Home Care Partners, the standard is 2 days a week, 3 hours each day. Okay. Yes, as I said, there's the comment in the chat is adding something else, some additional information about what the Caregiver Institute will pay for. They'll also pay for some supplies. They have lots of really good education topics as well. So that's a really good resource. It's all actually listed there on the website that I pasted into there. If your loved one has some sort of a disease like Parkinson's or MS, you might be able to get some home care paid for through those foundations. So it's worth kind of taking a look. We have some clients through the National Multiple Sclerosis Society, and they do pay for a minimal amount of caregivers per year. It's not very much money, but it is enough to at least give you a little bit of a respite. Okay, and the AAA down here, that's what that stands for. Again, so most of it's going to be private pay, and then the last individual or the last payer source tends to be the Medicaid waiver. So if you remember way back, this happened actually even before I finished grad school. There was a whole conversation about nobody wants to end up in a nursing home. Still, same conversation we're having today. And yet, how do we pay for people to stay in their own home? And isn't the care that they get in their own home better? So Medicaid, which again has some federal funding, but it's primarily for indigent individuals. If you're an older adult, it's primarily a state-funded program, Medicaid, for very low-income individuals. And the Medicaid waiver is essentially taking a piece of the long-term care Medicaid, so the Medicaid that would pay for you to stay in a nursing home, and moving it into the community. So you really need a high level of care. The ironic thing about this is that even though it came from kind of trying to transfer over that idea of, okay, if we don't want everybody to be in nursing homes and we want them to be at home, then how do we do that? So that's a place that has 24-hour care, but Medicaid waiver will never give you 24-hour care. I have seen it happen, but it takes a ton of advocacy, and I would say about 95% of the time it doesn't work. Typically, it doesn't work to have 24 hours. In DC, I think the most you can really count on getting is about 16 hours. And again, the thought on this is that you're moving people into a home where there are into their own home in the community where there are other people. So presumably they wouldn't need care overnight. However, if you're a part of the sandwich generation and you have to work a full-time job during the day, then it's also really hard to take care of somebody at night and still then get up and go to your job the next day. But the waiver is an option. And I would say the district actually does this fairly well. If you need Medicaid waiver in Maryland or Virginia, you will have a wait. In Maryland, the wait is about 5 years. In DC, they can get people on the Medicaid waiver in about a couple months' time. The other thing that's really nice about the Medicaid waiver in DC is that now it will pay for some assisted livings. This is true in every jurisdiction, but usually these places are really hard to find and the quality of care is not always great, but the district has really made a push for this. And I believe there are now 5 assisted livings that will accept Medicaid waiver. The full name of the 2 Medicaid waivers that might pay for this are the elderly person and disabled waiver, and then the home and community-based services waiver. And I do see we have a couple of questions in here. Nope, one is Frank reminding us, or somebody, Claire, maybe reminding us that we have access to those resources online. And then yes, Georgetown Care is very good. So I suspect they'll be one of the people that are talking with you. So there are, I would say, just like we talked about with the private caregivers, it's always good to start with your doctor. People trust their doctors. I would have to say that unless you're working with a geriatrician, there really aren't doctors who can just roll off the tongue 3 home care agencies, maybe not even 1, but it's always good to start with your doctor. Talk with your village, talk with friends who have had this, get an idea of their experience with it. Certainly a care manager like myself can give you good recommendations on agencies that you might want to work with. We in Seabury Care Management, although we do work with private duty aides, we prefer people to work with agencies. Again, we do not make decisions for our clients. We just make recommendations. So if you feel that a private duty aid is the best for you, then we will work with you to help find that or help coordinate that care if it's already in place when we come on board. But certainly a care manager or a social worker, the Department of Aging and Community Living, where your AAA is located, will also have names of individuals. I would say a care manager has worked more intimately with most home care agencies than the case managers with DACL, but that's not always the case. Interview. Even though I had said earlier that if a caregiver is working for an agency, they will have gone through an interview process, but it's still important for you as the family or the person who's hiring, they're going to be working with, to interview them as well. Most agencies have a liaison that can answer most of your questions, but I do think it's a really good idea to talk to the caregivers who might be working with you, just to give you a kind of a general idea. The one thing is that the agency will ask you to pay for that time. So I would keep that in mind, and I think that's fair. The other caution that I would say to you is that I find it takes a few weeks to settle in a caregiver. And the first person that you interview may not actually be the person who's there 2 weeks later. I kind of find that it takes 1 or 2 aides, and not usually because of you not liking them, but because they are working to make ends meet. So if they interview with you and they love you and they start working for you, and then their other client needs another 24 hours and you still only need 4 hours, I'm going to go with the 24 hours because that's the best financial decision for me. And it doesn't matter how much I love you. So that's one thing to kind of keep in mind. But I do think it's a good idea just to kind of get used to it. Ask what happens, whether you're hiring a private duty person or you're hiring an agency. What type of coverage is there if a caregiver gets sick or needs to travel out of the country, or God forbid wants to take a vacation? What happens? What is their criteria? What is the agency's criteria in hiring people? How do they assure that there's continuing education going on? How do they check the quality of care? Are they licensed and bonded? And then also, how does the agency assign caregivers to clients? And some of these questions are also good for private duty aides. Again, are they taking care of their licensure? Are they going to expect you to help with some of those costs? Again, kind of becoming an employer in some ways. What is their training and experience? Those are questions that you kind of have to start asking. Oops, I skipped. I'm going to answer what CBERI is at the end when we get to the questions. There was also they're typically one of the other questions, and I'm actually almost at the end of this presentation because we don't have much time left. Most hospitals don't have a agency affiliated with them. I would say one difference is Potomac Home Health kind of has a relationship with Suburban Hospital, and Potomac Home Health and Potomac Home Support. Again, you'll hear the two sides because Potomac Home Health is the skilled nursing side, and Potomac Home Support would be the private paid caregivers. I would say there's not as much anymore, but as far as home health, which insurance will pay for, and again, it's that limited amount of skilled care time. Some of those may have a a hospital affiliation. So these are just some of the questions that I would ask a caregiver. So the last page were questions that I would ask an agency. And if you're going to hire a private duty caregiver, then I would certainly ask the previous page questions. But these are the questions to ask the caregiver. You want to know why they're doing this work, how long they've been doing it for, what's their long-term goal. Because a lot of people, in fact, a lot of male caregivers, they're really not here to do caregiving in the home. This is just a step on their way to becoming a nurse. And many of the caregivers, actually, this is a step on their way to becoming an RN. What are you comfortable with? Some of the caregivers aren't as comfortable with helping somebody transfer in and out of the shower. Some of them aren't as comfortable with dementia and some of the behaviors, and they really just don't know how to deal with that. They all should have some training in it, but it doesn't mean that they're comfortable with it. Understanding their availability, and when I'm talking about availability, how many other agencies are they working for? How many other clients do they have? Are they working overnight before they come to your house in the morning? Then that's probably not a person that you want. And again, it's not your job to police this, but the agency might not even know this. How do you get to your job? Most caregivers in this area ride public transportation. They don't drive on their own. So the question about can you drive to my medical appointments? Some of them don't have their driver's license, so they wouldn't be able to drive you. So that's an important thing to ask the agency if you expect the caregiver to be driving you or your loved one somewhere. And some agencies require that if a caregiver is going to drive you, that they drive your car. Other agencies don't want to have the caregiver driving your car. So then you need to be comfortable with being in their car. Okay. We talked about liability. I think it's a good idea to ask about likes and dislikes as well as hobbies. Again, a caregiver doesn't have to be, they need to be near you. They can't leave the person that they're caring for. They can be in the other room, but they need to be within hearing distance. So especially if you have somebody who has dementia, this needs to be somebody who's going to get along with them, whose personality is going to work with that care receiver. And sometimes the person at the beginning of the relationship is not the person you need at the end of your relationship. Just an example of this, I remember I supervised a care manager who had a client with dementia who really needed kind of some tough love. She needed somebody who was going to be gentle but firm and really encourage the client to get up, to do some exercises, to keep moving throughout the day. And my care manager found a wonderful caregiver who could do all of that aspect. As the client declined, and she was able to get her to do things, like stand up and actually use her walker to go to the dining room to eat. She just did some amazing work with this client. But as the client started to decline and her dementia progressed, her method of doing things didn't change. And she no longer needed a gentle but firm caregiver. She needed a caregiver who would actually acquiesce and say, okay, we're not getting up today. Let's try something different. And this caregiver couldn't make the change. And my care manager came to me in tears saying, she's worked with this woman for 5 years and I have to fire her. I have to recommend to the family that they fire her. And they did and part of the reason was this person had 24-hour care. So my care manager could see that no, this gentle but firm wasn't working anymore. It needed to be a different approach. But it was one of the saddest days. So the person you start with may not be the person that needs to help for the long haul. All right, let's see if there's anything else here. Just make sure that you're developing an accurate plan. I think a care manager or a social worker can really help with this. What I see frequently is people shortchange what they think needs to be done. It can take a really long time to assist somebody with a shower in the morning. That hour for bathing that Medicare might pay for after a skilled care, that's going super fast. And they don't actually get to choose that, but I know some of my clients that would never work for them. Make sure that the person who's receiving the care is also involved as much as possible in it. Remember, you might have to start slow. It may be that you need somebody who doesn't look like a caregiver. I think many caregivers nowadays don't wear scrubs just because that can be a turnoff to whomever they're working with, or it's a big red flag to everybody that, oh, this is a caregiver. Again, thinking about the questions that have come back in the past, do you need this person to help out with medical appointments? Can that be done in 4 hours, or do we need to talk to the agency about extending some time? Most of them try to work with you if there's a medical appointment that comes up, but a caregiver can't leave a client alone. So it's really important to kind of plan that. Think about things like meal preparation and grocery shopping. Think about things like, is it appropriate for them to take them out down to the cherry blossoms? How do we engage them? Is that something that a caregiver is comfortable with? That's the piece that a lot of caregivers are not comfortable with, is the just sitting and being with an individual, playing cards with them, trying to pull them out of their shell. Try to allow the care person receiving the care as much control as possible. I just said, make sure that, or remember that a caregiver has to be with their client. So for example, if something happens where you as the family caregiver are really taking a minute of respite during this 4 hours and you get held up in traffic, that caregiver should not be leaving until you get back to the house, which often means that kind of backs things up. And that's not your problem, but I just want you to know that you can't just say, oh, it's okay, you can leave. They shouldn't leave, especially if there's something like dementia involved. We talked about they don't clean houses. Personal care often takes a lot longer. They do not administer medications. Maintaining boundaries, I think, is a big thing. I think there has to be a rapport between the caregivers and their clients. But I think it's also important to recognize that there's a professional relationship here. And when you're allowing somebody so close in that regards, it really can become very muddy. Most agencies do have policies about holiday gift giving or leaving, wanting to pay extra bonuses. Many agencies will kind of try to take care of that type of thing, whether they do, they'll let you know how they handle that. So just to kind of keep that in mind as well. Know that when you start talking about caregiving, there can be a lot of ambivalence to this. It's hard. There can be grief and guilt on both the caregiver and the person who's receiving the care. I talk in one of my other talks, we all know we're going to get older, but I'm the one who's not going to need the walker. I'm not going to be in my wheelchair. I'm definitely not going to need a caregiver. That's just sort of the way we think about ourselves. So this can be really hard, having to admit that you need the help. And sometimes you don't need help for long, but sometimes you just need a little bit to get over it, get over the hump. So I did promise you that I would say something about Seabury. The agency I work for is a larger nonprofit that is celebrating its 100th anniversary, as you can see from my sign here. We've been around for 100 years. We started when an Episcopalian widow donated her home to other Episcopalian widows who needed a place to live. And our mission is really to provide affordable services to older adults in the DC area. My program happens to be care management. So I'm the director of Seabury's care management program. We're all licensed clinical or licensed social workers, excuse me, who have been working in aging for at least 20 years. I'm actually one of the babies on the program. But our role is to really understand what our clients' needs are, what is already available in their support system, and then figure out kind of where those holes are or where there might be some support needed, and then know about the resources and help pull those in. So we've got 2 questions in here. Oh, nope. I can stop sharing the screen. Yes, screen. Oh. If I hit the right button. Okay, so there's no other questions. I answered it all other than what the agencies and then the private duty people are going to talk about. I did give Frank a fact sheet to hand out that kind of summarizes what I've been talking about. And I'm also happy to kind of talk through a situation on the phone with people if you'd like, just to understand what's going on.
Great. Thank you so much, Christine. I really appreciate that. I'm sorry I'm struggling with the technology here right now, but I do want to thank everyone for being here tonight, and for Christine for sharing her experience. When we talked about those of us that were planning this event, and we were talking about who could provide this information, of course, I thought of Christine, but I also thought about care managers who, typically are there to help the individuals and the family members figure out the best avenue forward. And so we wanted to have somebody, a care manager here to present this information objectively as the first part. And again, I'll repeat that the next series in this session will be having, I think, 5 or 6 different home care agencies present, and it will be a great opportunity for them to let you know how they operate and what their unique qualities are. We're really excited to have them, and for you to ask your questions directly of them in one setting. So that will be in a few weeks, and we will certainly get that information out to you. Since you've registered for this one, we'll make sure that you know about that one. And then the third one, again, will be those individuals from the community that have hired private individuals as home care aides, and what their experience has been. And we're trying to get actually some actual private care aides to be with us that evening. All of those sessions will be in the evening at 7 o'clock, 7 till 8:15 or so, specifically so that if there are other folks that are working during the day and they can't attend during the day, they can join in tonight. I will remind everyone that this video will be up tomorrow on our website at cwpv.org. That's cleveland-woodley-park-village.org. And you just scroll down a little bit under the header, and you'll see our blog section, and it'll be very obvious which one is there. I also put in the chat that a number of the home care agencies that were that will be detailing about in the next session are on our resources page, as are many other resources for those that are choosing to age in place in our community. And so I invite you to check that out at cwpv.org/resources. And I hope that that's helpful. You can also on our website subscribe to our newsletter. Hopefully everyone got this information from your local village. We have a lot of people here beyond Cleveland Woodley Park. You're always welcome to these types of events, but you're also welcome to subscribe to our newsletter if you'd like, and that's on our website. And finally, I'll say that on May 19th, we're really excited at the Omni Shoreham Hotel in their lovely garden. We're going to be hosting Jazz in the Garden from 4 to 6, and that's open to anyone in the community. So if you'd like to join us, please do so. I will make sure that I send out tomorrow both the slides and the handout that Christine mentioned to everyone via email. So you'll have those for any reference, and that also has Christine's contact information on it as well. Thank you very much, and I really appreciate everyone showing up tonight, and I hope it was helpful. We're always open to ideas about important topics like this that we should cover so that people can plan and make the best decisions for themselves and their family members. So thank you very much, and I'll look forward to seeing you all at our next session, the date to be determined, but very soon. Thanks very much.